Good morning, this is Patrick Salzberger again with Total Solution Partners. Picking up on our last conversation about the board and their responsibility for duty of care, we talked about embedded in that is reasonable inquiry. Building on reasonable inquiry, the board is not required to ferret out or audit certain parts of the hospital operations to satisfy their duty of care. They can rely on their compliance officer and management team. However, when information comes to them that should cause arousal or further inquiry, the board needs to pursue that, which is that reasonable, prudent person test. So where do we begin educating the board on what type of questions they should be asking of the management team? The OIG tells us there are two overarching areas the board needs to consider. One, structural questions, which means what's the scope of our compliance program. If we think about a field, we're trying to put a fence around that, so to speak, so the board understands what is the compliance program intended to cover. The second set of questions are operational. What the board needs to understand there is how well is our compliance program working day to day, week to week, inside our operations. So we have structural questions on the scope and operational questions on how effectively is the compliance program working. We'll build on this in some future videos.